Bom dia. Similar to my colleague Enrico, I will be speaking in English. It is what I know best, and I apologize. It is an honor to be present among so many leaders in the field of milk banking. And I thank you for this opportunity to speak as a representative of the Human Milk Banking Association of North America. Are my slides visible? I'll hope yes. My intent, good, thank you. My intent is to cover the North American experience of COVID-19 from the milk bank perspective. Most specifically, I'd like to cover how established the industry of milk banking is in both the United States and Canada, what we saw and how we responded during the pandemic. And I use the past tense, but I am well aware that the pandemic continues. And then what lessons we learned. So first of all, this is a picture of the United States and Canada with each blue drop representing an established independent milk bank, a member of the Human Milk Banking Association of North America, all accredited. The green drops are milk banks in development. We hope that they will join us soon. Since 1985, HMBANA has HMBANA was established in 1985, and we've seen a rapid growth in the number of milk banks and an increasing reliance on donor human milk in the neonatal intensive care units to meet the needs, most especially of the very low birth weight infants whose mothers didn't have enough or any milk for them. That is our predominant recipient of donor human milk in the North American continent. The safety of donor human milk is regulated by the Human Milk Banking Association of North American standards. These published standards are fluid, which means that they change continuously to reflect the feeding protocols in the neonatal intensive care units, new research, and best practices. They include minimum standards that all must follow for screening of donors, for processing of human milk, for storage and dispensing and prioritizing the dispensing of milk. They also mandate a food safety plan that includes 2 reasons to discard milk: a positive blood test for the mom who's in the process of being screened to determine appropriateness for milk donation, and a positive microbiology test after pasteurization. All milk dispensed must have 0 bacterial growth on a culture plate after following a standard operating procedure for development of that culture. There is also a mandatory annual review to verify adherence to the standards. So since the standards change over time, that's an important step to make sure that the milk banks are reflecting the updated requirements. COVID, we have not escaped that in the US or in Canada. I include the statistics here so that you can see just cases only. You can see that if you look at women aged 20 to 49 in the United States, we have a rate of 8 per 1,000. In Canada, it's a little bit lower, that same age range. So our women of childbearing years have about 3.5 to 4 per 1,000. A little bit lower, but this was significant enough to change how hospitals managed women and infants, and that had some significant implications for the milk banks. Many times when the moms who were having babies were actually diagnosed, this diagnosis was made on admission to the hospitals. Most hospitals requiring a rapid test on admission. And then many hospitals throughout the pandemic, at least in the initial 6 months of the pandemic, engaging in a protocol that separated mothers from infants if the mothers tested positive. That's a changing environment, but that had obvious, significant implications for breastfeeding success, both with healthy infants and with babies in the NICU. When we think about COVID-19 in the first 14 months or so of our experience, we kind of look at what we saw, and initially when the pandemic was declared, what we expected to see was an increase in the demand as the mothers and infants are separated, and as the mothers reflect the stress of the pandemic and all that's associated with it. We expected that to negatively impact breast milk supply. We also were receiving across the states and provinces very confusing mandates from our state and province governments regarding who was allowed to go to work and who was expected to be quarantined based on exposure or symptoms, who had to shelter in place, meaning they couldn't leave wherever they were, and then differences in the definitions of essential workers, with essential workers being required to go to work, people who worked in hospitals and people, initially people who taught children. But healthcare providers and milk banks weren't covered in those initial essential workers, so this was really confusing. HMBANA took an early leadership stance. We recognized the threats to the milk banking industry, and as early as March 27th in 2020, released a mandate to the milk banks calling for a prioritization of increasing donor screening and increasing pasteurization of human milk as a means to make sure that we had an adequate supply to meet what we forecasted as an increase in demand, and an adequate safe supply. We also mandated a continuing mandate, but a reminder that we have a mandate to cooperate. If you cannot, as an individual milk bank in the US or Canada, meet the demand or the request for donor human milk, it is expected that you contact one of the other milk banks or HMBANA's administrative office itself to let them know that you are in need of help, and another milk bank steps in. So, continuing challenges that we didn't quite anticipate are milk donors. As they were going through the application process, they have a required blood draw. They must be tested for HIV, HTLV, syphilis, and hepatitis B and C. Suddenly, we heard from them that they were very willing to be screened from an interview perspective, but they didn't want to go to the laboratories to have their blood drawn because they could potentially be in a lab with many sick people. They could be exposed during that time period. They also, once approved, were nervous about dropping off their milk, whether at a milk collection site or at a milk bank itself. They were afraid of human interaction, as we all were. And so we needed to respond to that. So once again, HMBANA stepped in with leadership, calling for changes. And so HMBANA worked to advise the individual milk banks about how they could be flexible, how they could hire and engage phlebotomists or blood drawers who could go out to applicants' homes to draw their blood. Thereby, applicants didn't leave to need their home. Alternatively, those of us with big contracts with blood laboratories negotiated changes in those contracts where the laboratories allowed our milk donor applicants to arrive in the first hour that the lab was open each day, not exposed to anyone who might be there for a different purpose, so only exposed to other healthy mothers who were hoping to be able to donate their milk. We addressed the fear of dropping off milk and the interaction that would require by sending shipping coolers with labels and ice packs directly to the donors so that the donors could pack up their coolers in their homes, leave that cooler on the porch at an approved time, and a carrier, Federal Express or United Parcel Service in the United States, would pick up the milk from their porch. When the milk donors lived so remotely that this wasn't possible, we used a huge cadre of volunteers, just women and men of varying ages who wanted to volunteer in some way to help the pandemic efforts, who would then pick up the milk for donation from the woman's porch and bring it to one of the milk collection sites or to the milk bank itself. These porch angels were amazing in their ability to show up in protective equipment and pick up the milk safely and transport it safely. And we increased outreach. We knew that the existing bed of milk donors wasn't going to be enough if we were right about the increased need for human milk. And so HMBANA created tools like that you see on the left, very simple outreach tools that could be used to spread via social media, via everyone's websites, that could help spread the need for donor human milk as a way that somebody might be useful. So we worked hard. We also faced unprecedented and unforecasted fears within the milk banks themselves. If there was a mandate from HMBANA, not from the states or the provinces, to continue the work of the milk banks, what we didn't anticipate is that staff would be afraid of each other, and they'd be afraid of the milk, because initial documents that were published built up these fears of milk being one of the ways that COVID-19 could be transmitted. And they built up erroneously fears that the bottles themselves of milk or the packaging in which milk came would also perhaps be a means of transfer of this virus. And of course, we faced supply issues. Here on the North American continent, personal protection equipment and sanitation supplies became very limited. So HMBANA once again took a leadership responsibility, and they collaborated with researchers who were willing to investigate some of these false claims, or seemingly false claims at the time. They are false. And so we reached out to researchers, known collaborators, who agreed to investigate whether or not the SARS-CoV-2 virus was actually present in milk in a form that could transmit the virus. And we also had them follow our protocols for pasteurization, so the Holder protocol of heating milk to 62.5 degrees Celsius for 30 minutes, testing the milk to see if the virus was indeed in the milk. Could it be rendered inactive by that pasteurization process? The answer to those two research questions was no and yes. Human milk does not convey the virus, and if you happen to just spit into the milk or inoculate it somehow with active virus, Holder pasteurization destroys it. And those data have been published by us and multiple other researchers. We also worked hard within HMBANA and continue to work hard to foster collaboration between the banks. A weekly survey went out to the banks so that we could keep our finger on the data that would show who was experiencing a shortage in incoming milk, who was experiencing a shortage of processed milk. And those weekly surveys helped us to A, be reassured that we were okay, and B, be aware whenever there was trouble around the corner that might lead several banks to pick up where supply was lacking. We also fully engaged in education. So if you look at HMBANA's website, you see a whole section on COVID-19, and they are a series of released statements on the safety of human milk during this pandemic. They point to very solid research showing how human milk is not the transmitter of this virus. And on and on. The education pieces that were created are intentionally educating milk banks and mothers and providers, the stakeholders in the world of milk banking during this pandemic. Those weekly surveys, different from what we feared, revealed that most of the milk banks remained in operation over the last 14 months and are expected to continue in operation. They revealed that the ounces dispensed in 2020, despite our fears that they would decrease because of lack of supplies and because of lack of operating hours, and because of lack of milk, instead increased. So we had a record-breaking more than 14,000 milk donors across the 31 HMBANA milk banks in Canada and the US, and they gave abundantly. 13% increase in incoming milk in 2020 over 2019. This is amazing, actually, and I included a quote from Lindsay Groff, who's the executive director of HMBANA, because her leadership is how we maintained our solidarity, how we focused on the history of the safety and quality of donor human milk, how we focused on the facts and not the fears that were being published. Overall, in 2020, the majority of milk banks reported that while they had a slight decrease in both donated milk and the use of donor human milk, or the demand for donor human milk, in April and May of 2020, since then they have had an increase, a normal or slight increased usage. So we consider ourselves quite fortunate, and the work has been and is continuing to be successful. In total, to make this real, I'll give you the numbers. We dispensed across the HMBANA milk banks about 7.5 million ounces in 2020, and in liters, that's 221,802 liters of donor human milk. And again, that's a 13% increase. So here's just a picture for fun. This is just one of my walk-in freezers. We never intend to have bags stacked on each other or bags in the center of a walk-in freezer. But this is raw milk waiting for pasteurization, and it's what all of the milk banks have experienced, an amazing outpouring of milk from approved milk donors. We learned some lessons, so no pandemic should go by without lessons learned. We learned that research needs to immediate. That 2-month period where we experienced decreased milk supply and decreased demand was directly the result of very false information being out there. We needed to jump quicker on the research collaboration. We needed to jump quicker on the publications that would cite what's known about the beneficial qualities of human milk and why mothers and infants should never be separated. We learned that fake news had to be shut down. Enough said about that. We don't own that problem, but we certainly contributed tremendously here in the US. We learned that we need emergency procedures to protect the staff and the process. We sort of wrestled with emergency procedures, some of which were already in place in the sort of what if kind of scenario, and some that weren't in place. We need transparency and communication, the willingness of the milk banks to to fill out a weekly survey and share what their supply and what the demand looked like, helped us all to make sure that there was never a vulnerable baby who went without donor human milk. And lastly, minimum standards and emergency procedures across the nations are key to shared resources. And I put this in here just to reflect HMBANA's recognition that our continent's experience of the pandemic and its effects on milk banking and on mothers and infants may be different from other continents, as we've heard even just today. And there's a way with collaboration and with standardized minimum standards to collaborate not just across our continent, but across all continents to make sure that no baby suffers and all families have hope. And with that, obrigada.